If beta blockers confuse you, you only have to know 3 main things. I can fix that, like any confusion, in less than 3 minutes. All right, so beta blockers are what we call parasympathetic chiller outers. Yeah, that's not a medical term, but that's what they are. So they are massive chiller outers. They're gonna chill out the heart. If you can remember these 3 main things, then you can get most of your adverse effects, side effects from these 3 main things. Beta blockers are going to decrease heart rate, blood pressure, electrical activity, and contractility. All right, so we can get everything off of these 3. It's going to lower the heart rate. Beta blockers lower heart rate. So if they lower the heart rate, then we're worried about bradycardia. So you need to check their heart rate before you give beta blockers and hold it if their heart rate is less than 60. Otherwise, you're going to cause their heart rate to tank into the toilet, and we don't want that. All right. Second thing beta blockers do is they lower blood pressure. A lot of times that's what we're giving them for, is for hypertension. So if we know that they lower blood pressure, then we worry about hypotension, right? So you have to take their blood pressure before you give beta blockers, and we're going to hold for a blood pressure less than 90/60. Otherwise, you're going to tank their blood pressure, all right? So check heart rate and blood pressure before you give them, because they do both those things. Since we said the beta blockers are parasympathetic, right? So that's the rest and digest, and they're chiller outers, then they're going to make the heart just work a little bit like slower and softer, okay? So instead of the heart, right, it's just going to boom, 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 which is great. That's kind of how we want it to work, right? We want it to work nice and slow and doing its thing, okay? However, when you're on too many beta blockers or the dose is too high, it may really chill it out. If that's the case, that's not really going to give us enough perfusion, right? And it might slow it down too much to where your heart's a little too sleepy. So you have to watch for heart block and then CHF if it's not pumping hard enough because it made it a little too lazy, all right? Other big giant things you need to know about beta blockers: we do not rapidly withdraw. If you've been giving a chiller outer for a long time and making the heart go, oh, and it's just been enjoying its zen, and then all of a sudden you take them off the beta blockers, boom, 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 they're going to have some really bad symptoms. So we do not rapidly withdraw. We're going to kind of taper them off of this, okay? This is another big NCLEX testable thing here. Mask the first sign and symptom of hypoglycemia. What is the first sign and symptom of hypoglycemia? What's your warning sign, your patient's warning sign that, you're getting hypoglycemic? That is tachycardia. That's their first, warning sign that you're starting to get hypoglycemic. They start to panic. Because it decreases the heart rate, they may miss that first sign of hypoglycemia. So it's important to educate your diabetic patients that, hey, you're not going to get that warning sign. So you need to have some honey, some icing, something ready, and be able to recognize your signs of hypoglycemia if you're on beta blockers. All right. People always get confused about selective and non-selective. We're not going to go into a ton of patho, but I do want to have some memory tricks to help you remember this. So you're going to remember Miss Penis. I'm very sorry about that. Okay, but that's just the way that it is. So metoprolol, remember beta blockers are LOLs. Metoprolol is selective, miss. Propranolol is non-selective, penis, miss penis. Okay, and now why is that important? Because our non-selective beta blockers can cause wheezing and hypoglycemia. All right. So if you have a patient that's on a beta blocker and they are on a non-selective, or they'll say propranolol, and we hear wheezing, that needs to be reported immediately, because that means that their airways are starting to close. All right. It can also cause hypoglycemia, okay? So remember, beta blockers are chiller outers. So if we start going into parasympathetic, the airways are going to start to tighten, the blood sugar is going to start to go down. Usually it's not a big deal, but hypoglycemia can be a really big deal, and new onset wheezing on beta blockers, especially on non-selective, is a big deal. Did you know this about beta blockers? Can you remember it based on the 3 main things? All right, these are the biggest things you need to know for NCLEX. I have an entire pharmacology playlist. You can take a look at that on my page.